So welcome to everybody. Thank you, Dr. David, for that nice introduction. In full disclosure, Anastasia Dimitropoulos has taken over for me as the director of the Schubert Center, but I'm still involved with them. I just want to give her her due. So I'm very pleased to see all of you. It looks to me like there are a lot of us. There are about 160 some of us. And the way Haruv has called this lectures from the couch, I hope everybody's comfortable. I would like to think that we can have a relaxed conversation today, and that you can pose what questions you might have to Paula as or Dr. David as we go through. And so I'd first like to thank, of course, Haruv Israel and my good friends and colleagues there who I got to spend some time with this year that was cut short by the lockdown, both in Israel and here in Ohio, where our governor also has us on a stay-at-home order, and his health director has become a rock star with young children dressing up and making videos of being like her. So we're all at home, and we are very happy to have this brilliant idea of lectures going on while we're all at home and trying to keep up with the rapid pace of what is going on. And so I'd like to, of course, thank Paula David, Dr. David, and Gal for organizing this, and Asher from the home front, Asher Ben Aryeh in Israel. And so I'd like to talk today for a while about how we can use an ecological perspective to look at the challenges for reducing risk to child maltreating and promoting well-being in these times of the coronavirus or COVID-19. Paula, my slides are not advancing.
Are you on presentation, slide presentation?
Yeah. Oh, there they are. Okay, they just advance more slowly. So welcome to all of you today. I gather from Paula, most of you are calling in from Oklahoma, where I've been lucky enough to be once, and I hope that all of you are well. So thank you and welcome to everyone, and I look forward to our time together. So I'd just like to start by saying that the circumstances that we're facing today, most of us have just never experienced or thought that we would be experiencing. So we don't really fully understand the situation in which we find ourselves, and we're all doing the best that we can do to try and both reduce the risk of virus transmission and also think about how we protect children from child abuse as we're all engaged in doing. So children are not a high-risk group for the disease, at least in those industrialized societies we know most about. We have no idea really yet what the burden, the disease burden will be on children as we see the spread of the virus to parts of the world like Africa that we don't yet know how this is going to play out. But children and parents are isolated so that maltreatment may go unobserved and unreported. So what we're all doing is making our best informed hypotheses about their increased risk and what we should do about it. And so while in other times, seeing reduced rates of child maltreatment is a cause for celebration and looking for why this might have happened, now we are more skeptical because we don't have any way into seeing these children or how they're doing. So in many states, in my own home state of Ohio, we see sometimes up to a 50% decrease in child maltreatment reports but we don't really know what's going on with children. The other thing that we're struck with is the disproportionality of and the disparities that are occurring in child maltreatment, with the recognition that like other bad outcomes, COVID-19 is striking our underrepresented populations in very serious ways. And our public health folks and epidemiologists are taking a look at this, and it is a challenge for moving forward and figuring out what to do. So I thought that what I would do is do a quick search of the media to see how much attention and therefore how much confusing information we're all getting at one time. So the New York Times had a really nice op-ed piece by a child abuse pediatrician, Dr. Nina Agarwal, who talked about how the crisis is creating conditions for a rise in violence that is really impacting our children, and we need to address. I also thought that with the multitude of posts I get every day, I would just do a quick Google search to see what kinds of things are out there that people are looking through and trying to get some guidance. So if you Google in helping children understand coronavirus, you're getting like 900 million hits on what it is. Now, this is not a systematic review. This is just if you were a normal lay person or a normal professional and wanted to see what was out there, you took a quick look. Helping children cope with coronavirus. You can see the enormous number of hits and advice that parents are getting. Activities for children and parents is a big number of hits as people try to figure out what to do with children that they're not accustomed to staying home with on a daily basis. And then if you Google in coronavirus, yesterday there were 276 million hits on child abuse and coronavirus. The number has changed by today, but there's a lot of confusion about what to do and how to make sense of all of this. What we are coming to think about is that we're in a very conflicted situation because measures for reducing COVID-19 risk in the population may exacerbate risks for child maltreatment. And so we are challenged to think about how to address these competing and important needs for our society. So most of our governors in the US, for those of you who are zooming in from other countries, most of our states, except for a few, have closed non-essential businesses, trying to keep the risk of infection down. But for children, this has created more difficult circumstances in many cases because of parental unemployment, which increases poverty and stress, and family stress on family resources. This has shown the disparity in our country between workers who need to go to work and those who can stay home, but it's created a different kind of circumstance for children. Closing our schools has seemed like a good strategy for decreasing the risk of the virus, but it's isolated children and parents at home in novel circumstances and with really very little warning. This happened very quickly. Also at the university level where I teach, this happened very quickly. Social distancing and now wearing masks also has been a great help as in either crushing or flattening the curve, but then we have diminished scrutiny of children for maltreatment and well-being. their social networks are constrained because we're trying to protect elders from being exposed to younger people who may be asymptomatically carrying the virus. And also there are disparities in abilities to social distance and thus transmission. So many segments of our poorer population are going to work in grocery stores and in service work where they're not social distancing. And so this may be also increasing the risk for their children. So we're working with competing priorities about how to address the virus. And I think that child abuse professionals have a role to play here, and we need to keep this broader perspective in mind. So over time, we've seen an evolving perspective on child maltreatment and its causes using an ecological model. And so as all of you know and remember, early days of the child abuse field, when Henry Kemp coined the term the battered child syndrome, the focus was very much on the individual parent and child and how they interacted and how you decreased risk factors in the parent. And since that time, there's been a broadening of how we understand the etiology or the causes of child maltreatment, and therefore where the multiple places are or the multiple avenues there are for intervention. Around 25 years ago, the National Academy of Sciences, the National Research Council, convened an expert panel to take a look at the state of research on child abuse and how really to move forward. And that panel was powerful, or had an impact in moving away from a focus on more individual causality and pointed to a transactional ecological model for child maltreatment. And so what we often use now to try and explain or think about the occurrence of child maltreatment is an ecological model like this one, which if you Google up ecological models, you have hundreds and hundreds of choices. And so you can pick and choose from those that you find compelling. What's interesting and important about this particular visualization of the model is that it's not, an ecological model doesn't require looking so much at each individual circle, so that we're interested in risk factors in the individual, but we're also interested, I think you can see my cursor, in how they interact with all of the other systems. So this is not to say that we're not interested in each of these factors that come with them, but we want to know how they interact. So if you're a high-risk parent, however high risk is being defined in your programs, what does it mean to live in one kind of neighborhood versus another? And we've been looking at this in Cleveland, but that's for another time. Today, I'd like to really focus on what this ecological model tells us and helps us about entry points and thinking about child maltreatment. So right now, for example, we know that neighborhoods and schools have impact on children's well-being and on rates of child maltreatment. Neighborhood and community has been associated in literature. But now we see with the schools closed, you take this out of the model, and neighborhoods on stay-at-home orders, you have increased stress on parents and decreased visibility of children. As we said a few minutes ago, So it requires us to really think through our risk factors and our different programs and how they are interacting with the different systems that, impact children. So sometimes in the past, child abuse professionals have felt like we were in the desert and that the global world was not paying too much attention to child maltreatment. So I want to take just a minute going back to this ecological model to, instead of starting from the individual and moving out, starting from these outer circles and think about how they impact child maltreatment work. So there are numerous global initiatives now to address child maltreatment specifically. Most of us are very familiar with the UN Convention on the Rights of the Child and Article 19 that I'll come to in the next slide. The UN also developed their Sustainable Development Goals, and through efforts of many child-related international groups, managed to have one of the goals to be ending abuse, exploitation, and trafficking against children. And this has created many organizations, including a global partnership to end violence against children that has a website and is very active. So as you all remember, Article 19 from the UN Convention on the Rights of the Child really pointed the world towards the fact that children are experiencing abuse, neglect, maltreatment, trafficking, and other forms of harmful conditions throughout the world, and that the world needs to unite and try and protect children. The UN then developed Sustainable Development Goals, and under 16, peace, justice, and strong institutions, the development goal is to end abuse and all trafficking, exploitation, and all forms of violence against children. So there has been an interesting move in international efforts to look at strategies to reduce violence against children that we can look at in light of this unprecedented situation that we're facing now. So you can see in these strategies for ending violence against children that many of the risk factors for child maltreatment are addressed, such as increasing parent and caregiver support, but that there are also larger efforts to implement laws, to think about norms and values, and to basically improve the well-being of children overall, to do income strengthening and try to improve the lives of families. So because there's such enormous diversity of children's experiences throughout the world, as we stay in this outer circle, I'd like to just remind us of the impact of culture. After all, I'm an anthropologist, and so it's hard to miss this opportunity to talk about culture. So there are enormous diversities in children's experiences around the world. Globalization, migration, refugees, and changing demographics means that we really need to attend to the different ways that cultures address and deal with maltreatment and work with these cultures. We also are increasingly recognizing disproportionality, which means that something is experienced by a population in greater magnitude than presence in the population, and disparities or inequality in treatment both between and within society. Our public health practitioners are making very powerful statements about the risk to underrepresented populations of these kinds of health risks, including COVID-19 and including child maltreatment. So I just want to point out that the strength of culture as such an important influence of the people with whom the child's involved, the activities in which they engage, their daily routines, and their opportunities and challenges. And all of this play into how culture then impacts child maltreatment. This also is a graphic that you can find many different forms of simply by Googling, but there has been an effort to really try and understand how culture impacts both defining and intervening in child maltreatment. And over time, there have been different terms that have been used to try and address how you should deal with culture. It started with cultural sensitivity, being aware that there are other cultures, moved out into thinking about a term called cultural, knowing in that culture and understand the different pathways that cultures provide. And now the term cultural humility has come to ask us to take into account that we are learners about other cultures and that members of these groups need to be involved in thinking about how we address these problems. So continuing to move in this circle, one of the important things that is rooted in culture and in society is the relationship of social support and child protection. And so I refer you, if you're looking for an excellent resource from the mid-90s from Ross Thompson, who's looking at the question of social support and child protection. So Dr. Thompson pointed us to the fact that social support does important things for reducing bad outcomes for children in child maltreatment, provides emotional and financial and informational kinds of support to families when it's working well. It doesn't always work well, as we'll talk about in just a minute. Dr. Thompson also pointed us to some additional functions of social support that have a relevance to what we're dealing with now. So social support also influences the ability for social control. That is, when you're embedded in a social network, it provides context for standards and for the scrutiny and enforcement of those standards. And also for, that is, your network has impact in trying to get people to follow norms, as we looked at in the global strategies, to positive behaviors around families and childcare. When we're in this situation of stay-at-home orders and lockdowns and closing of schools and essential businesses, these functions are disrupted. And so children have less access to other adults who, as we know, one of the long-term factors contributing to good outcome for abused children is the presence of significant others and adults. Well, this is compromised now, and we have to think about inroads to address some of these issues of diminished social support and the remediation and control that come with them. Dr. Thompson also pointed to the importance, which we don't have to spend a lot of time on now, of how people perceive that support versus what behaviors are actually being directed towards individuals. So perhaps someone engages in an interaction 3 times a week with a family, but it's not perceived as very supportive. So you need to really look at how social support is provided and recognize that social networks can have positive and negative aspects. Years ago, when I studied women who had killed their children, or who had children who were died as a result of abuse and neglect, they often had many people in their networks, but these were bad networks that were not supportive of positive child rearing practices, saw children as difficult and needing a lot of punishment and discipline, and supported to their detriment these mothers in the feeling that they were, in quotes, good mothers. And so the enacted support maybe was high, but it was not having the impact that we might have wanted. Social support and networks have been also associated with what in social science we call social capital. The most basic form comes back from James Coleman's work, where social capital really provides a network of linking social resources to actions and outcomes. And it's embedded in relations among people. You often don't know it's there, but it's a resource for action. And so it's very hard to measure, but it's also a producer of positive outcomes for children. So I'd like to digress for just another moment to talk about Amish society as an example of social capital. Child abuse is known in Amish societies, all forms, but this is a familiar picture of what happens when you need a new barn, or when your barn burns down, what happens? So it looks very crowded on this barn being built, but everybody comes to help. Recently, we were out in an Amish community where someone had a house fire on a Thursday, and by a week the next Friday, their house was completely rebuilt, because everybody comes over after work, gives a few hours, and tries to help. So when there's a case of maltreatment, the bishop, who's the leader of the community, and others try to figure out what is the broader situation for the family. Is the husband unhappy in his job? Is there some way that the community can try and help? And so it's not at all surprising. This may seem, it's not at all surprising to see that out in our Amish communities in Ohio, they are making masks for our healthcare providers and the rest of us. And notably, this is a way to help the larger society, but also deal with the same kinds of stresses they're experiencing in job loss with the closing of many non-essential businesses that they also work in. So I'd like to draw our attention back to what we all know about child maltreatment for just a moment. We all know that it exists in multiple forms, that multiple factors go into the etiology, that there is disproportionality in its frequency and disparities, and that child maltreatment is the subject of an enormous literature. Many of us who were around in the old days used to sort of talk about how quickly one could do a review of the literature on child abuse, on domestic violence, on other kinds of issues, but it's now the subject of a substantial literature and gives us guidance on how to think about these ecological models and these multiple levels of causality and places for or sites for intervention. I'd like to also note that in this talk, we're talking about both child maltreatment and child well-being, which are not simply different ends of the continuum, but they do reflect how in each of our countries and globally, we think about how children are faring in today's world. And so I'd like to draw you back to Professor Ben Arieh's ideas about how understandings of child well-being have evolved also over the years. So Professor Ben Arieh has alerted us to the idea that ideas about well-being have changed from just looking at whether children survive to how they're thriving and how they're expressing their own ideas about well-being. So this also, in a time of this virus, the COVID-19, it draws us to think about how we're trying to attend to the various needs of children in a time when all of us are very focused on the high rates of death and threats to the survival of many of people in our population. The second point Dr. Ben Arieh made was thinking about how we move from looking only at negative outcomes to trying to think about what's really positive. So we're all trying to think about how to prevent child maltreatment, and both local and global efforts are also thinking about how by increasing child's well-being, you also decrease the risks for child maltreatment. So these two concepts do go together. Professor Ben Arieh pointed us to the idea that we need to look more at children's well-being. How are they perceiving their lives and thinking about their circumstances, while of course also paying attention to what's called well-becoming, or looking at the circumstances of children in terms of how they're going to mature and progress into adulthood. We've expanded our thinking about well-being into new domains, how our children are using the media, how they're using social networks, which may or may not help them to increase their social context during this time of COVID-19. So if we think back for a moment to schools being closed, essential businesses being curtailed, there are many recommendations for continuing children's education by using the internet, sometimes forgetting that access to the internet is not equally distributed even in industrialized populations and certainly globally. So this challenges us to really think about the final point, which is how do we put together, and the Children's World Project has made enormous strides in this, a more composite index of children's well-being. Knowledge about well-being, I'll make a shameless reference to a handbook that an international group of us put together. So if you're curious about a particular domain, you can take a look at the more than 110 chapters and 200 plus authors that are putting their best minds to this and trying to think about how we understand child maltreatment. So how does an ecological approach guide child protection? And then I'd really like to open this to your ideas since many of you are right on the lines and how we accomplish these kinds of goals. So I think it's important for all of us working in child protection to remember that we all have a role to play in bringing our experience and expertise and in sharing our experience. So there are many innovative things going on both locally and globally. Can we do home visitation remotely using the internet? Does it work? Does it help? We think it will, but do we know? So we need to share these experiences, and we need to work in multidisciplinary teams so we know whether these kinds of innovations actually are helping children in these unusual circumstances that we all believe are likely to be with us for a while. So how do we think about enhancing social contact with families who are in need of this, in home visiting, in check-ins with adolescents to see how they're doing, and how do we both do research and document to make sure we know what aspects of this are helping. There are multiple ways to promote child protection in times when we know that risk factors are exacerbated and protections are diminished. But this is, child protection workers have always been creative, have always thought of ways to institute programs, and now this challenges us. And I think we need to share our resources and think about ways that we can enhance the ability to connect with families in a way that makes sense, in a way that helps them. The US is, and other countries as well, but I'm most familiar with what's happening here, is making a major point of recognizing the disproportionality of COVID-19 and relating it to other maladies that afflict our underrepresented populations. And this is an opportunity to get a handle on our healthcare systems, on structural racism, on access to care, on abilities to distance based on your economic situation, and to apply these to child protection. And as we do this, I'd like to end before we open it up for discussion, and I look forward to hearing your ideas and thoughts on this, that we need to really think about how families are embedded in this larger ecological frame, and how a perturbation in one level can influence others, and just how we keep this in mind in both getting more access to children in need of help right now, and trying to think about how to deliver that. And so I may have talked more quickly than I intended, but I'd really like to also hear your thoughts and ideas that Paula is going to moderate. And I'd like to also remind us all that in the United States, this is Child Abuse Prevention Month, and that Congress is being called upon to increase funding by the National Association of Social Workers and by others to increase funding and to help us address these needs of our abused and maltreated children. So thank you so much. And Paula, you're going to take it from here.
Right. Okay. So if anybody would like to write a question or a comment on the chat, then I'll be happy to field them for Jill. And we might even be a little brave, and if somebody wants to try opening their mic and asking questions, we'll see if that works with 190 people here. I'm going to start, while you all get started thinking about that, with a comment, that the first chat comment that we got, which says, I work with teenagers as a behavioral health coach in the school, and I have noticed that they are a lot more resistant to talking over the phone or doing a video chat for some reason.
Would you say that again? They're more resistant to talking on the phone than in video chat?
No, or video chatting. They're resistant to them both for some reason. It's something that she's a big, you asked a little bit about people's experiences in using the distance.
Right. So I think that's a very helpful comment, and I'd like to hear other people's ideas about this. But this goes back to the idea that adults always know what children want. And because they're so good at social networking and using the internet, that this is a vehicle. So in my limited looking around at programs, I've seen really both, that sometimes young people are initiating these phone or chat room or Zoom conversations, and in other circumstances, they don't necessarily want to convey this information where they don't know where it's going. So I wonder if you've asked, or what we could learn from, I'm sure you've asked them why they don't particularly like this.
Somebody wrote that that it's incongruent and doesn't feel comfortable for them.
So can they give you suggestions about what would feel comfortable for them?
So possibility.
Yeah.
Okay. And people say here that they're much more into texting. And somebody said, this is what technology has done to our youth. My daughter and stepson would much rather text than talk on the phone. Even I would rather text than talk sometimes, and I'm 51. Another comment is that there's a potential for parents to overhear due to sheltering in place.
Right.
Somebody added also that privacy may be a concern for them, and that they are at home and who else is at home, and can other people hear them as well.
Yeah, I think all of this goes back to what we've been trying to talk about today, that this is really an important point, and thank you so much for bringing it up, that we think that maybe we can transfer modalities to get into homes, but it may actually exacerbate risks for children if they think their parents know they're going to be complaining or talking about how they're being treated. This has been, I've seen also a concern in trying to intervene in domestic violence and protect women from domestic violence when they're at home with their spouses. There's really very little way to call for help without the abuser knowing it. And so I think that it's it's just a side comment too. If you take a look at some of the research on our physiological responses to stress, that trying to find ways that young people feel more confident that their privacy is protected. So yeah. I would love to see some answers from your young people about what they might suggest as ways to communicate with them.
There's a lot of comments about that here, about talking with people. One says to invite to take a walk or ask if there is a time or space that's more private. And also texting might feel less exposing or less vulnerable. Somebody added also that, hold on, I have to, that it's happening as well with adult clients, that it seems to be a common trend. Another person added, I'm a comprehensive home-based provider, and some of my families also struggle with virtual sessions and rather than just a phone conversation. And internet is also a big issue in Southwest Oklahoma. That seems to be another issue.
Yeah. So I think these are all really good and important points as we struggle with, can technology really replace this face-to-face contact that's so important in child protection work and in supporting families? And I think that they're helpful in alerting us to assumptions we may make that young people who chat happily and dance on TikTok can also express or feel safe expressing these concerns.
Right, right.
So,
A few more comments about that, and then I'm going to move to a different topic. They say that building rapport with new clients is especially difficult when you have to do it over the phone or video. And a youth leader wrote that she's a youth leader at her church, and the children that are stressed out about not being able to celebrate their birthdays. So yesterday, a group of us did a drive-by birthday shout out, and the parents videotaped it. It meant the world to that teenager. We still adhere to the social distancing implementation. So there you go for creativity.
Yeah, I think that a lot of the news media is pointing to these very interesting drive-by birthdays, serenading a family who's had a loss, trying to find other ways. They're very creative. In denser populations in Europe, you see people coming out every night at 8 o'clock to applaud their healthcare workers and their service workers. So I think that as we struggle with how hard this is, we also need to keep another column for the kinds of positive things that people are doing and the kindnesses that they're showing one another, and figure out how to extend those to abusive families who are so often isolated anyway. Before this even starts, they're isolated. So I also just want to make a small comment that those of you who are child protection workers and on the front lines, you really are among the workers that the rest of us owe a great debt to, because you're putting yourselves at risk and trying to help families. So it's the healthcare workers and child protection workers and service workers that we owe this enormous debt to.
The next questions are about well checks on families and kids with abusive or neglect backgrounds. If anybody is doing in the United States, are there programs, are there people trying to do well checks on families? And somebody said here that she is doing well checks with foster families using FaceTime. And that also the home visitation staffs in various agencies are using FaceTime phone calls and tests. So that's one of the issues here, is how you do a well check and if they're being done.
Would the person who posted that, do they have an idea of how well they're working? Because, the United States, I'm speaking out to those of you who are from elsewhere, has a healthcare system that doesn't necessarily address, or that doesn't address these needs. And so we've moved to some telehealth for addressing these issues, but they're mostly, to my understanding, around when there's a healthcare problem or issue, but not well checked. So I'm happy to hear that this is going on in some places.
Yes, somebody asked if there's any tips for assessing safety during this time with the interactions being limited to technology-based ways.
This is another one. I think that we need to share experiences about this, because as a previous comment said, it's maybe difficult for young people or for parents to divulge difficulties or lack of safety when on the internet, you don't always know where that information is going. And you haven't had the ability to establish rapport in a relationship always. So for those of you who are doing well checks, how are those going?
There seems to be some people are saying that they're really struggling with having any kind of meaningful relationships and honest conversations with the digital attempts to make contact. And others are saying that they actually are doing okay. One woman wrote that she works with families that the children are in custody and that they're doing well checks. And they also have a dedicated team to do face-to-face contact to assess safety. Somebody put up a crisis line for the number of us, crisis line for teenagers. It's called I Need Help. If you text I Need Help to 741-741, then a worker will respond from that area. So I think people are having kind of mixed results with that. Somebody says here that it works well, the well checks, that she works, that she texts foster parents to schedule a FaceTime call, and they know that I must see my kiddo. We spend about 15 minutes per call.
That's positive. That's positive. I think, you know, it's really encouraging to hear that people are trying different things. I think that that how to move these into a more systematic structure is something we're trying to figure out. I mean, I think we need to also recognize that we've only been at this a relatively short time in trying to cope with this new stay at home and social isolation and schools being closed, but it's likely to be with us for a while longer. So figuring out how to share this information with people trying to do well checks. And it may be that some families do well with internet checks and other families may need more face-to-face.
Right. Okay, there's one says that she seems to have a hard time with younger multiple children in one home, that it's very chaotic. Yeah. To talk to them. And I have, these are a lot of good advice here. One says, I'm treating my virtual visits just as I would in person. The only difference is we are virtual. I ask for my, wait, I lost it. Hold on. I asked for my kiddos to go to their rooms to speak with them alone. I asked them things that are specific to the children. I also ask, I keep losing the, sorry, everybody. It's hard to move this back and forth. So she's able to see people, kids in their rooms to be able to check how they're doing.
Yeah. Well, as you know, anthropologists are not clinicians. And so I'm, you know, in deep awe of the kind of work that all of you are managing to continue doing and trying to protect the children that are in your care. I think that, you know, trying to think about the broader perspective is something that is helpful, but you really are working on the day-to-day of how do you protect and make sure that a specific child is doing well. And so in thinking about this broader ecological perspective, I do not mean in any way to draw attention away from the seriously important work of dealing on a child by child basis to try and improve their well-being.
Okay, thank you. We still have a few more minutes if there are any other questions. I agree with you, Jill, that people are really trying to do their day-to-day work with very difficult situation here. Yeah. Yeah. So would anybody else like to open their microphone? I see now we're getting lots of messages about CEUs. Is there anybody that would like to open their microphone to say something before we end? This is your chance.
Hi, this is Pam Klaskins. Sorry, I'll turn my video on too. This is Pam Klaskins. I'm with the National Children's Advocacy Center in Huntsville, Alabama. And I'm just wondering if you think there's anything important that as a country that we're missing with respect to these kids and protecting kids. Thanks.
Hi, Pam. Thank you for your comment. I think that we're missing an enormous amount in this country that but that people are making efforts now, and that this may be, while it's a time of enormous challenges, it may be a time of opportunity of trying to improve the system moving forward. So I think that for decades, our child protection system has been populated by dedicated people doing important work, but that the structure has been, the structure and the national commitment has needed more funding, needed more specialties, needed all kinds of things. And excuse me. So I really thank you for pointing that out, and think that it's a time now in Child Abuse Prevention Month also to lobby Congress and lobby our state legislatures about the good things that many governors are doing around addressing the virus threat, to think about also protecting the most vulnerable people now, the most vulnerable young children and adolescents, but the vulnerable children who need these services. So thank you.
Hello.
Okay.
Hi.
Everybody writing in.
Hi. It's Sharon.
How to do
Can you hear me?
Yes.
this mute.
I was
Stop
just
video.
saying I think it's important to do check-ins with the parents or foster parents as well, just to give them an opportunity to just vent. So if we can just give them a call and just say, hey, how are you doing? How's it going? And give them an opportunity. It lessens the stress, and they really do think that you care about them and not just the child that they're caring for. Because, we're all in this together. And if you have funding and you're able to maybe have a delivery of a meal, because there's a lot of that service going around. And if there's a large family, that's dealing with a lot of stressors and dealing with the fact that all their children are home, if you're able to do that and just send them a meal, that'd be a great gesture, and they're more open to talking to you.
What a great suggestion. Thank you.
You're welcome.
We have time for one more question. Sandy raised her hand, so we can hear from you, and then that'll be our last question for this evening. Did you want to say something? Is it Sandy? It says Sandy's iPad? No, okay. Okay, so we're going to stop here. Thank you so much to Professor Korbin for inaugurating this lecture series. It was a great way to begin.
Well, thank you all for joining me, and I wish you all the best, and would love to stay in touch with all of you. So,
I hope that everybody keeps healthy and safe.
yes, stay healthy, stay safe, and keep doing the wonderful work you're all doing.
Okay, bye-bye.
Bye. Thank you, bye.
Bye.